All right, good morning, guys. We're going to be going over Chapter 8. Excuse me. Like I said before, general pharmacology. Okay, it shouldn't be a real long session. We only carry quite a few drugs, so it shouldn't take that long. Let's go ahead and get started. Our generic names. Drugs are, hold on for a second. Okay. Pharmacology is the study of medications. All right, they use the term medications instead of drugs, just for the simple fact is when you say drugs, people think of narcotics, okay? The dose is the amount of medication given, and then, of course, the action is a therapeutic action that you receive after you take this medication. Contraindications is a reason not to give a certain medication to an individual, okay? And then the side effects, anything that happens, adverse reactions that could happen to someone who takes one of the medications, whether it be hives, whether it be wheezing in the chest, who knows. So those are the side effects that may happen after you give someone medication, okay? Medication names, you have generic, which is the original chemical name, or the trade name, brand name, okay? The generic names are not capitalized, and some drugs, i.e. nitroglycerin, are called by their generic name more often than their trade names, okay? A trade name, brand name that the manufacturer gives the drugs or medication. Tylenol or Lasix, remember Lasix, formosicide, I think that's how you pronounce it. Formosicide, okay? So those are the difference between generic and the trade names. Okay, trade names begins with a capital letter. One drug may have more than one trade name. Remember that, okay? And then prescription drugs are distributed only by the pharmacist or the physician's orders, okay? OTCs or over-the-counters can be purchased without a prescription. Okay, routes of administration. Okay, you have absorption, IV, intravenous injection, PO, which is oral, SL, sublingual, IM, intermuscular injection, IO, or interosseous, subcutaneous, transcutaneous, okay, which is through the skin, inhalation, or pre-rectum, PR, okay. Some of the only ones that we really worry about are the oral, intermuscular, which is our EpiPens, and then inhalers, which we can assist with. Okay, those are the ones that someone who has an inhaler or oral glucose would be oral. Okay, intermuscular are EpiPens, aspirins, oral. Okay, so those are the ones that we will be assisting patients with. Okay. Medications come in tablets or capsules, all right? Solutions or suspensions, okay? Or a metered dose inhaler, okay? Which you only get when, just like an inhaler, you only get a certain amount of that medication when they take a breath, okay? Topical medications, transcutaneous medications, gels, which is our glucose, and then, of course, gases for inhalation, oxygen. Okay, we just went through this: metered doses, topical, transcutaneous, gels, and gases. Okay, oxygen. Of course, we all carry them on the trucks. We carry them along with EMS. Oral glucose. We carry 2 tubes within our kits, guys, all right? And they're 15 grams each. We only give 1 per our protocol. Okay? Some EMS systems allow us to carry aspirin or epinephrine. Of course, we carry the EpiPen, and then, of course, we carry the baby aspirin. Make sure you go through the protocols. Okay? Let's go ahead and let's start off with our oral glucose when we go through our medication here. We got a short video. All right, now, just for your enjoyment, here's another short video. All right, guys. Again, go through this. Go through your protocols. It's protocol 6.1. Make sure you understand that. The video prior to that, when it showed it, put it on a tongue depressor. You can do that. We have our bite sticks in there, or you can just squeeze it into the corner of their cheeks and let them do it that way. All right. So let's see. We have nitro. We have epi. Let's go back here. I apologize. And we have a aspirin demonstration. All right. Going right through these, okay, guys? I'm just going to touch on it again, okay? Make sure you read the contraindications for all of these, okay? Now, let's go to our EpiPen demonstration. Another webcam. Okay, and we have another web video here for you. Okay, guys, remember with the epinephrine, okay, when I come around to do the skills demonstration, we will be going through these. I do have trainers, so we will be practicing with these on each other, okay? They do not have needles, so we don't have to worry about that. I'm sure some of you wouldn't mind, but, you know, we will be doing the trainers. It did make a comment in the first video to remove the clothing. The ones that we carry the needles are strong enough to go through the jeans as well, but try not to go through the seam of the jean. Try to go through an area to where you can miss the pocket and anything else in there, okay? Now what we're going to do is we're going to go through, even though we don't carry them, our metered inhaler doses, okay? We don't carry them, but we can assist patients with those, okay? So we're going to watch a quick video on that one as well. Okay, it's real important when you give a metered dose inhaler that you always confirm that the patient is alert enough to use inhaler, and make sure that that is that patient's inhaler, okay? You don't give, if it's a wife, you don't give her his, if it's her husband's or whatever else, okay? And then again, take a listen to lung sounds, right? Listen to see whether or not if that helps clear up anything. A lot of times it will, okay? And then instruct the patient to hold his or her breath after they do it. And then, again, monitor your patient. Give them O2 if you have to. All right? Now we're going to go through our nitro. We don't carry these, but patients sometimes have them at their home, whether it be tablet or a spray. So let's go ahead and watch two little quick videos on those as well. Okay, that was for a tablet. Now remember, we're going to use a tablet in a cardiac patient to relieve angina pain, okay? It increases blood flow by relieving spasms and causes anterior arteries to dilate by relaxing the muscles of the coronary arteries and veins, okay? It also relaxes the veins throughout the body. Less blood is returned to the heart, which decreases the workload of the blood pressure, okay? That's why it's important that before you give nitro, you make sure that their blood pressure is over 100, okay? Always check the blood pressure before administering, okay? Their systolic blood pressure of less than 100 may be harmful, okay? A lot of times when you give someone nitro, they kind of get a little bit more lightheaded, dizziness, or sick. So the patient may you need to make sure the patient is sitting down or even lying down. Okay, and then you can raise his or her legs. If the nitroglycerin no longer brings relief to the patient to whom has previously worked, the patient may be experiencing an MI, okay, instead of an angina attack. Okay, always ask them how much nitro they have been placed in the past to relieve the pain. Sometimes they take 2 and that relieves. Sometimes by the time we get there they've taken 3, sometimes 4, who knows. So always make sure you ask them that. Okay, report to medical control. We're going to go by our protocols, okay, which is chest pain, okay, and then we're going to give all this information to the medics when they get there, okay. Nitroglycerin, okay, the following effects. Again, it relaxes the muscular walls of the coronary arteries and veins, less blood returning to the heart, which decreases the preload. It decreases the blood pressure and relaxes the veins throughout the body. Often causes a mild headache after administration. Okay, so let's go ahead and real quick, let me show you a quick little demonstration on the spray nitro as well. Okay, again, sublingual is very simple. Again, we want to make sure that anytime you use a patient's medication, always make sure it's that patient's, make sure it's in date, and then that way you can make sure that that patient will not have any adverse reactions to it. Okay, it's placed underneath the tongue. It should create a slight tingling and burning sensation. If it hasn't, it may has lost its potency, okay, of aging or improper storage. If it's stored somewhere where it gets hot in time, a lot of times like in their car or something other else like that. Okay, again, make sure that it's in date and make sure that it is the patient's. Okay, the steps for administration, again, we don't need, we can assist them. Okay, so as long as it's theirs, we are allowed to assist them. Make sure that you take a blood pressure. It has to be greater than 100. Okay, systolic. Make sure, again, right medication, right patient, right route, which is sublingual, under the tongue, or tablets. Question the patient about the last dose, whether or not they've taken one prior to you getting there. Okay, and then recheck their vital signs after 5 minutes. Okay, document their blood pressure, their pulse, respiratory rate prior, and then 5 minutes afterwards, do it again and write all this stuff down. That way you can give everything to the paramedics when they get there. Okay, moving right along. Okay, when in doubt, follow our protocols. Okay, guys, make sure that you are reading through our protocols. I know a lot of times with everything else that's going on, you know, we forget about these, but make sure you go through our protocols and you know them as well as possible. Okay, we should know them pretty good, so then that way there's no questions. Okay, again, verify the proper medication and the prescription, verifying the form, the route, and the dose. Check the expiration date, check the condition of the medication. Remember, on our EpiPens, there's a small sight glass above the needle area that you can look in there. Take those out of those containers on Mondays when you guys check them and make sure that they're not cloudy or anything else. If they are, take them out of service, let me know, and we'll get some new ones. Always reassess the vital signs and document, if you happen to give medication, document when you gave it, where you gave it, okay, and their vital signs before and after. Okay, patient's medications, obtain a complete list. A lot of times when there's 3 of us on the truck, there's a bystander or the family member, we can always go in, we can ask them where their medication is. If it's in another room, we can go in there and grab as much of it as you can. That gives us a lot of information of what's going on with the patient, whether they have cardiac, respiratory, or whatever else. That way we have a whole list of it, and they can give it to you. A lot of elderly people nowadays, they have so many of them, they keep a list of them. Remember, some people keep them inside their refrigerator, a list. It's called a vial of life. They keep them inside their refrigerator. That way we know that if there's no one there, take a look in the refrigerator, see if there's something in there. Okay, and then also it will help us give it to Manatee County EMS, so then that way they get there, they go, okay, hey, look, this is what's going on, and we can proceed in this area. And then, of course, never forget to ask about if they're taking any over-the-counter medications. Okay, just because they're on one certain medication, they may be taking something else, and that could have caused this. All right. Okay, well, like I said, that's a quick little overview of general pharmacology. In a few weeks or so, I'll be coming around again and doing your skills evaluations. If you guys have any questions whatsoever, go ahead and contact Captain Sousa, and we'll see you guys in a couple weeks. Thank you.